Hey everyone, welcome back to Staying Connected, a show where I talk to other people about their stories with Vascular Ehlers-Danlos Syndrome. Today we're doing a special episode for Reds for Veds Day, and I have Bella here to talk to us about her story with Vascular Ehlers-Danlos Syndrome. Hey Bella.
Hi, Katie.
I'm so excited that you're going to talk to me about your story.
Me too. I'm a little, nervous, but I'm excited to get it out there.
It always feels good to get it out. So tell us about who you are and how old you are.
Okay, so I'm Bella, Isabella Marin, 25, and I've been diagnosed with vEDS since I was 10, so about 15 years now.
So how are you diagnosed with vEDS?
So I consider myself lucky the way that I was diagnosed. I was diagnosed when I was little, and mostly because of my mom's persistence in getting me tested. So when I was a toddler, I had the thin, translucent skin that a lot of people with vEDS have, and you can see my veins, they're very visible, and I would bruise spontaneously. And my mom just saw that and thought it was abnormal, and she told my pediatric doctor, and he was like, this is normal, kids bruise all the time, they're bumping into things and falling everywhere. And she told him that I was not a hyper kid. She was like, she's so chill and just kind of sits there and she doesn't run into things, and these bruises just pop up, and I don't know, there's no reason for them. So she kept insisting that something was wrong. So they did some blood work, and that came back abnormal. So then he referred my mom to a hematologist oncologist, and from there he diagnosed me with some lab work with von Willebrand's disease, and that was when I was 5. So I had that diagnosis, and von Willebrand's is a bleeding disorder, so it means that my blood takes longer to clot than with normal people.
Mm-hmm.
So if I get a bruise, it'll kind of be bigger than what it should be, and I bruise easily because of that. My the blood vessels, the clots, I don't know how to explain it, but the platelets don't really adhere well to help the blood clot.
Okay.
And so I would bleed easily as well with my skin that would tear, which was because of the vEDS, but we didn't know yet.
Okay.
And so I was diagnosed with that. So that would explain the easy bruising, and I would have nosebleeds too. And so that was when I was 5. And a few years later, when I was 9, my mom realized that I didn't bleed as much as I should for a person that has a bleeding disorder. So I would have nosebleeds, but they weren't too bad. And when I would get cut, it would take longer to clot. I guess you could tell that was abnormal, but it still wasn't as much bleeding as I should have.
Okay.
And so one of the times we're at the park, I was walking in the dugout on the bench, and I slid down the fence. And what should have been a scrape, it burst my knee open, and I had to go to the hospital to get stitches. I want to say I had about 11 stitches, and when they were putting the stitches in, I wasn't numbing well. I still felt everything, and they told my mom that I was basically a crybaby because I'm just a kid who might split their knee open, I'm being dramatic. Mm-hmm. And so my mom kept telling my doctor this isn't right. She was feeling everything that was going on, because I never really complained too much about cuts. And so my hematologist oncologist decided to do some further testing, and he didn't tell my mom what he was looking for, but they did a skin biopsy from my shin, and throughout that time I was feeling the entire thing too. I don't remember exactly the pain or anything, but my doctor told me that he was not freaking out, but he was kind of worried that I was feeling everything,
Mm-hmm.
And so I guess they did a connective tissue disorders panel, and they sent it to Seattle, and it came back when I was 10 positive for vEDS. And I just remember that day, I was young and I didn't really know what was going on, but I knew it had to be serious because I remember they sent me to the little playroom while my mom and my doctor just talked about it the whole time. So I knew that it didn't come back well, but I didn't know how severe this condition would be, you know?
Mm-hmm.
So I was lucky to get diagnosed that way instead of having to have a serious complication like a perforation or something happen first and then get the diagnosis. Because I think that getting this diagnosis at such an early age has helped me to kind of not prevent these episodes, because you can't, but to stay on top of things, you know?
Yeah. So what was it like growing up knowing that you had this?
So it was hard. I remember that my cousins, because I grew up in a really big family. All my cousins are here, and they would like to roughhouse all the time and wrestle, and I couldn't. I had to kind of either sit out or just risk something happening to me, and I remember I couldn't do any sports growing up, and I remember being sad, and sometimes I don't know if it's the fact that I couldn't play sports that made me want to do them. Like, I don't know if I was a normal person that I would actually even want to play sports, but I couldn't. I remember for PE, my mom talked to them, and I would have to sit out from a lot of sports, and I was mad. I would have to go to like the library or just sit there and watch people, and it sucks being different when you're a kid, you know?
Mm-hmm.
So that was a big change for me, and just trying to teach people on how to be cautious with me. Like, I remember one time one of my cousins, I think he threw a ball and it hit my shoulder and I had a big old bruise, and he got in trouble. So sometimes I was scared that my cousins would hate me because they'd always get in trouble if I got hurt, you know?
Yeah.
So it was difficult in that sense growing up, because luckily my diagnosis didn't arrive at a time where it was super life-changing, because I can't imagine getting the diagnosis now and then having to adjust my life after living a normal life for so long, you know?
Mm-hmm. So what kind of complications have you had with this?
So I've had a few major ones. I had done pretty well, I guess, if you can say, up until I was 18. Like, the main things that I would just get are a lot of cuts and bruises, and I had been hospitalized before I was 18 for like the inflammation in the intestines, but nothing too serious. Like, I remember one time I was in the hospital and I was like, it's just dehydration. And then they're like, dehydration's pretty serious. But I'm like, if you look at that compared to some of the other stuff I can get, I'll take it, you know? And so I started when I was 18. I was in my senior year of high school, and I had my first bowel obstruction. And I had to get surgery that time. I missed about a month of school, and they actually removed a small piece in my small intestine because it was so inflamed. And I actually just found out last week that I had a small perforation that time too, just because the intestine was so inflamed and large that it was kind of tearing. It had little micro tears in it.
Wow.
Yeah, so I had to get surgery for that, and at that point, that was like the hardest thing for me that I'd ever gone through. And my doctor did pretty well at explaining like the protocol, what they should do, and managing afterwards. So like, I wasn't allowed to use my abdominal muscles for a while, and I did fine. I did pretty well after that. But then a few months later, so this was in March. A few months later that year, I was in my first semester of college, and I had another bowel obstruction. And so the scar tissue from the first one caused an obstruction later on. So they had to open me up again, and they had to just like cut the scar tissue away from the intestine that was causing the obstruction. So that one was a lot easier to recover from than the first one, just because the first one they took out my small piece of the intestine.
Mm-hmm.
But that was the first couple of major things that happened to me, which was pretty scary, you know?
Yeah.
And then, so I had done fine. That was in 2012. And then in 2015, I had torn my calf muscle. So that is kind of a long story in itself, too. It was in November of 2015. I was out country dancing. I love to go two-stepping. And
That's awesome.
I know everybody always tells me, they tell me not to go because I always get injured. from there, but I like it, so I'm not
You
gonna.
have to do something
I'm gonna
you
keep
like.
going, you know? Exactly. So it was a line dance tear. I was wearing boots. It wasn't even heels, and I had felt my calf muscle just hurting. You know, it just kind of felt sore. So I got off the dance floor, and it kind of felt good to stretch it, but after a while, it kind of hurt to stand on it. So I told my friend, I think we gotta go. I can't really stand, and it's hurting. So we left, and I went home, and my leg was huge. It was swollen, and we went to the ER just because we were concerned for blood clots, because I'm at risk for blood clots also. Ironically, my blood doesn't clot, but I'm at risk for blood clots. And so we went and they ruled that out. So we were happy. So my hematologist said that it was probably a hematoma in my calf muscle. So I had like a bruise in the muscle that was bleeding. And so he had me stay off of it for a couple of weeks, and then it was fine. I was walking again. I was doing physical therapy to kind of get that muscle strength and motion back. And then a few months later, I was walking around on campus, and I was doing the elliptical again because I'm like, okay, I have to strengthen my muscles to prevent muscle injuries from happening, right? So that a few months later, I had felt my calf muscle pain again, and it was worse because before I could at least walk on my tiptoe and it was fine, but now I couldn't even put my weight on my leg at all. So they did an MRI, and they had seen that a few of my muscle, like the muscle fascia that surrounds the muscle, a few of those little fibers were torn, partially torn. And so I had to stay off of it, and that was in 2016, so it was a few months after 2015, right? That was at the end the first time. So in 2016, in March, since there's not a lot of research done with vEDS, nobody really knows how to go about treating injuries or anything. Everybody just kind of freeballs it. And so they told me just to rest for a bit, and then I could start walking again. So all 2016, what it was doing was healing and then tearing again, because they would say, okay, you can walk, and I'd walk, and it would tear again. So it wasn't until later on that year, I want to say maybe 8 months later, they finally put me in one of those big orthopedic boots. And I was in that for I want to say a year and a half.
Wow.
And they told me to stay off of it completely. So I was in a wheelchair because the crutches, when I would use them, it would rupture the vessels in my hands from the pressure and my own weight walking with the crutches. So I went through a long year and a half being in the wheelchair, not being able to get myself places, and having my friends wheel me around everywhere. And on campus, my campus is full of hills, so they got their workout. And so that was my second major event. It had finally healed. I was still in crutches for my pre-nursing courses. I'm a nurse now. I graduated. And
congratulations.
Thank you. So I was in crutches that first semester, and then I was in the boot in my actual first semester of the program. So it was doing fine. It was doing fine. That was in 2017. I had finally gotten out of the boot, and I was scared. I was scared to take it off. And my orthopedist, he actually goes to one of the hospitals that I was at the first semester, and he would see me, and he was like, "Do not be in the boot. You'll be fine." He's like, "You can bring it." He's like, "You can bring it, but just leave it in the break room, and you can put it on if you need it." So I was like, dang, I have to listen to him because he comes here, he'll see me, you know? So yeah, I started doing better after then. And I was thankful, honestly, that it was not GI issues, because I'd rather have my calf muscle tear than have to go through surgeries and everything, just because they're so risky and it's hard to recover. So then in 2018, last year, yeah, the beginning of 2018 in February, I started to get a lot of GI issues. So in February, I started feeling, I had school that day. I came home after a test, and I had this weird feeling in my stomach under my belly button, and it felt like I was just stuck in a sit-up for a long time, like just in a crunch, if that makes sense. You know how when you do too many of those, you feel sore there. So I was like, this is weird, because I never use my abdominal muscles. That's something that I was told I can't do. I can't do sit-ups or push-ups. And because of the pressure that it puts on the intestines and the organs that are there. So I tried to like unbutton my pants and put myself in ways where it would try to relieve that pain, and it wouldn't go away. But it was more annoying than painful. So I just remember sitting there, and then it felt like there was a bunch of gas buildup in my intestines, and I was trying to let some out, but nothing would come out, right? So then after a while, I felt this really strong, sharp pain, kind of like I got punched in the stomach, and then it was gone. And then I felt a warm feeling go down my legs, and I got a metallic taste in my mouth, and I was very shaky. So I was like, okay, this is not normal.
Yeah.
So I got to tell my mom, and we're very lucky because my hematologist, he's the one that diagnosed me. He's a pediatric doctor, but he still follows me to this day. So whenever I have something weird like that, I have his cell number to call or text him, and he'll tell me whether or not to go to the ER. So we called him. He said to go ahead and go, and they didn't find anything wrong. I had a little bit of inflammation. My lab markers for that were a little elevated, but it wasn't. They did scans. Everything was normal. So they admitted me just for observation, and I was fine. So I was there for about 5 days, and then since that hospital visit, I never got better. I had a hard time keeping foods up. I remember just trying to do, they always tell us to do like clear liquid diet or liquid diet whenever you have inflammation, just to kind of calm things down and see if that helps. So I had tried doing that. I was drinking just broths and maybe some green juice, but every time that I would drink like the green juice, my stomach would cramp ugly. And it was a whole cycle all that year, and I had lost a lot of weight. I lost 30 pounds in 2018 because of all my GI issues. Yeah, I laughed because I had.
Or did they determine what it was that caused the pain?
Yeah, they did. So it turns out that I have a fructose malabsorption. So they had referred me to a GI doctor, and it wasn't until July of that year, of 2018, that I found out that if I eat things high in fructose, like fruits or juices, high fructose corn syrup, then it causes a lot of GI symptoms. So I was like, that makes perfect sense. I'm drinking those green juices, which are full of fruits, and that was hurting my stomach. And before this hospitalization in February, I was taking big like bowls of fruit to eat during lecture. I had a 4-hour class. Like I needed a snack, you know? And so, yeah, it was the fruit that caused all of that. And I take Miralax every day, and I was drinking it with apple juice, which was like the worst one for me. And I discovered that's what was wrong with me. So then I had to kind of modify my diet to that low fructose diet, or at least in moderation. And it's hard because there's no set thing. Everybody that has these GI issues, they're so different, and doctors are like, basically, you try this food, and if it sits well, you continue eating it, and if it doesn't, then you stay away. So I have to do trial and error and learn the hard way whether or not foods agree with me. And so that was in July. And actually, I wanted to mention too, I had seen the GI doctor, and he didn't really, the one that diagnosed me with the fructose malabsorption, he didn't understand vEDS. He was telling me that my intestines are very strong, and I don't need to worry about constipation. I'll be fine. So I was like, yeah, sure, but 18-year-olds don't have bowel obstructions. They don't have this weak collagen, you know? So he just didn't get it. And ironically, the next month after I got the fructose malabsorption, my colon perforated. So that was my next major thing that happened to me. All these pains, they come on suddenly, and it's funny because I always tell my mom that if I have just annoying like dull pain, that's fine. If I have pain for a week, it's fine. But if it's like sudden, all of like in a day, and then, you know what I mean? Like it just comes out of nowhere. That's when I'm worried. So I'd rather have like constant pain than the sudden pain that comes on out of nowhere, because that's serious all the time.
Yeah.
So, so my colon perforated, and I was lucky enough to avoid having surgery with that. That was in August of 2018. And I was in the hospital for about 10 days, and they just kind of monitored me and made sure that I didn't get like peritonitis and infection in my abdominal cavity or sepsis or anything. And they put a drain in because I had abscesses develop from everything that leaked out into the cavity out of my intestines. Which I would much rather have the drain than have to go through those surgeries, you know?
Yeah.
So I had been doing fine since then, but my intestines were never the same. Like, I was okay, but they never went back to normal since before last year. And I've had a few hospitalizations since then. And it's funny, too, because, you know, nobody wishes they were in the hospital, but they always happen at times where I didn't really have to miss a lot of school, or it kind of worked with my schedule. So I was like, if this is the time to be sick, like, I'll take it, you know?
Yeah.
And yeah, so I was able to graduate in December, and it was pretty hard. And I was doing okay up until last month, March, when I had a seizure. So I've never had a seizure in my life. I don't have epilepsy or anything. And I was at a friend's house. I had my mom go pick me up because it was too, like, I didn't feel comfortable driving. And we came home, and I told her, I'm going to run inside, Mom, because I'm either going to vomit or poop. Something has to come out to make me feel better. And so I went to sit on the toilet, and that's like the last thing I remember. And apparently my sodium levels had dropped so low that they caused me to have a seizure. So the seizure, it dislocated both of my shoulders, and normally I guess the dislocations heal pretty well, but with the dislocations I also feel fractures on both sides. The top of the humerus, I always explain to people that it's like a sphere, like a fist. It's dented in, so I tell them that it looks like Pac-Man, like his mouth. That's the dent on both bones on both sides. So that's been a long healing process for me, because I'm not supposed to reach backwards or rotate my shoulders inwards, because that's the way that they dislocated. So I'm already at risk for dislocations, but right now while it's healing, I'm not supposed to do that. And since I was immobilized for about 9 days with big old pillows and slings, I had to relearn how to use my arms again. So I couldn't reach my face the first week, and I've had to relearn the movement of my shoulder and have to regain muscle mass. So it's been a big struggle. I have to have people help me with everything. So I'm not working or in school or anything right now. I'm able to focus just on getting better, but it's been a struggle. It's been a long year already.
Wow. You've been through a lot.
Yeah. Honestly, it's funny because I feel like I haven't, but when I talk about it or I write it out, I'm like, damn, it's the whole, I could publish a book on everything.
Yeah. So how have you done with this, like, emotionally?
It's been a little hard. It's been hard because when I hang out with my friends or family, I feel like I'm a burden. I feel like I hold them back. Even before all of this, I remember when we go to concerts and it's like general admission, I can't be up in the front because people are constantly pushing and everything. And I feel like we have to be way in the back. And I just feel like I hold a lot of people back from doing things that they want to do and stuff. For the most part, I've had great friends and family that understand, but it still doesn't take away that feeling, you know?
Yeah.
So that, and like you said, that I've been through a lot, it feels like I'm 60. It feels like I have I've lived such a long life, you know, and I'm only 25. So that's been a little hard to deal with. It's hard when you have people that don't understand, if that makes sense. Like, people can try to understand as much as they want, but nobody knows what it feels like unless they go through this themselves, you know? That's been something hard for me too, because a lot of people don't understand that I'm never going to get better. I'm never going to heal. Like, sure, my shoulders, they've gotten a lot better, but I'm never going to be fully healed or fixed, because a lot of people don't understand. Like with my calf muscle tear, there are still some days where I might have to show up in the boot that I was wearing before just to kind of help it calm down. People don't understand that I'm never going to be fixed. Once it's broken, it's going to be broken, you know? So that's a thing that's hard for me to get across to people also. And the fact that sometimes I get really tired and I can be fine one morning and then even the next night just be super terrible. I can wake up feeling fine. Wake up feeling terrible and then be fine at night.
Mm-hmm.
So it's hard for people to get, I guess, how I do things. Like I went to DC a couple weeks ago with my shoulders, and up until that point I was kind of avoiding all my family parties just because there was a lot of stress for me to kind of avoid people touching my shoulders, and it's draining for me. So I think a lot of people don't understand that, yeah, I can go to DC but not go to this family party, you know?
Mm-hmm. And it was so great meeting you there.
I know, it was awesome. It was like therapy for me.
Yeah. What did the seizure feel like?
So that I'm thankful for. I don't remember because my sodium levels were so low. I had altered mental status, so I don't even remember the feeling of my arms my shoulders being dislocated.
Wow.
I just know, and that's kind of the downfall to that too, I guess, because I went 8 hours before somebody discovered that I was dislocated. I remember bits and pieces because I was kind of in and out. I just remember that I was laying on my back and it hurt because my shoulders dislocated backwards. So it hurt being on my back because I'm sitting on the bone that's supposed to be in my shoulder. Yeah, and I remember trying to sit myself up and I couldn't because I couldn't use my arms. So I remember just kind of using my neck to try to sit myself up, and I would ask my brother and my dad to help me sit up because I couldn't do it. And right when they would slide their fingers under my arms, it would hurt because my arms are dislocated, right? So it took a while for them to discover that. I don't know what it feels like when they put them back in because they put me under. I'm thankful for that, but I'm also scared that in the future, if they do dislocate, because I'm at risk now for them to dislocate all the time, that I won't know what the pain feels like. So I'm kind of scared for the day that happens.
That's crazy.
Yeah, I never thought that would happen to me. Like, seizure was the last thing on the list of things that could happen to me, you know?
Yeah, I sit here and I think, okay, like artery rupture, dissection, bowel perforation. Yeah. Like, I don't have epilepsy, so seizures on the very, very bottom of the list.
Exactly.
That's crazy. That's insane. Do they know why your salt levels bottomed out?
So they're thinking I had gotten an infusion of a new medication that I'd never had before that Monday. Mm-hmm. Because that Monday I was at my hematologist appointment, and he does labs every time I go there. Everything was fine. They were perfect. And my sodium has always been like dead center in the middle of the range. And I got an infusion of that medication, and that medication was supposed to be to prevent fractures because I have a little bit of osteoporosis. Mm-hmm. So that's what's funny about it too. It's supposed to prevent it, and then I still happened to get one. But I had gotten it that Monday, and we think that it might have just messed with my electrolytes a little bit, and a combination of that plus the side effects, I had a lack of appetite. So I didn't eat anything for maybe like 2 or 3 days, just maybe Jell-O and water. Mm-hmm. And then, so I'm thinking maybe my sodium might have also gotten diluted at the same time. And then I was increasing the Miralax because I felt sick from my GI issues, and so I was probably losing sodium that way also. So I think it was just a combination of everything that week that might have just caused them to drop suddenly. Yeah.
What a bad combination of things.
Right? But it's funny, too, at the same time, because since then, my intestines have been so much better than they have been in a year. I'm like, maybe it reset my intestines or something. Or maybe I'm just focusing on this, right? Yeah.
That's crazy.
So, yeah, I've been through a lot, I guess, and I'm lucky. I have 2 degrees. I have my psychology degree and my nursing degree, and those are a little bit hard to do. But I also wanted to give a shout out to my friends and family because they honestly helped me like support, their emotional support and physical support. I have cousins and friends who like literally wipe my ass for me now. You know? So I'm like, I've just gotten so much closer with all of them, and I don't think I would have gotten this far without everybody, you know? So I wanted to just give a shout out.
Yeah, that's awesome that you have that support.
Yeah, it helps a lot.
Do you plan to go for a nursing job now that you've got your degree once you get better?
I want to. That's been something that I've been debating about, just because nursing is so physically demanding. For sure, I can't right now because I can barely like write, you know. I'm not too sure how long it's going to take for my shoulders to heal, and nobody can really give me an answer because nobody's dislocated both shoulders at the same time that have vascular Ehlers-Danlos, you know, all these little variables. And I'm thinking if I do go back, I might do the neonatal intensive care. So that's something that I've been looking into, but I also have a research background, so I might just stick on the research side of things. So I'm still kind of debating about what I want to do, but I have my license and everything, so I'm ready to go. Just need my body to catch up with me.
That's awesome.
Yeah.
That's so cool that you got through that and got your degree and everything. It's very cool.
I don't know how. I look back and I'm like, I don't know what I was thinking.
Willpower.
Yeah.
Willpower and perseverance. I think we have to have a pretty good combo of that. So
I think we're like the best at that.
Yeah. Really, congratulations.
And I'm pretty sure it's more the fact that we're like, vEDS doesn't let us do this, so it's like, no, we're gonna show it that we can. It's more like our stubbornness that makes us do things, you know.
I don't know what you're talking about at all. I'm not stubborn in the slightest.
Right, like, yeah.
I'm very stubborn. I totally get it.
Yeah.
That's
But
really
I feel like
awesome.
we're all the same.
Yeah, like, don't tell me I can't do something.
Exactly. It's like reverse psychology, I guess. If anybody wants us to get us to do something, just tell us we can't do it.
Yep.
There we go.
Yep. Well, thank you so much for talking to me. Is there anything else that you wanted to share that we didn't hit on?
I feel like we covered everything. I just wanted to also mention just how lucky I am to have my doctor, my hematologist oncologist. I mean, he's been following me for 20 years, and him and his nurses there at the clinic, like, they are just the most giving people that I have ever met. So it just, if there's any medical professionals listening to this, it helps a lot to have a lot of compassion for your patients. So yeah, just that. It's pretty much all my complications and everything that I've been through. But yeah, I could talk for hours on this probably.
Well, thanks again so much for talking with me today.
Yeah, thanks for having me, Katie. I was so excited.
Well, thank you everybody for listening. Again, this was Staying Connected, and this was Bella telling her story with Vascular Ehlers-Danlos Syndrome. I have an episode coming out on the last Sunday of every month, so stay tuned, subscribe on your podcast player, and share this podcast to help us raise awareness for vEDS. Thanks again, and I'll talk to you soon.